Local and regional flaps in oral cavity cancer reconstruction. A case-based approach is the first edition of a book by Muhammad Faisal, Abdul Ahmed, Raza Hussain, and Michael Gilhooly, published in 2026 by CRC Press, part of the Taylor and Francis Group. The book belongs to the fields of oral and maxillofacial, oncologic, and reconstructive surgery and is intended for surgeons and surgical trainees who treat tumors of the oral cavity. The authors define it as a practical case-based atlas. They recognize microvascular reconstruction as the standard of care for many complex defects but emphasize that it is not always feasible because of comorbidities, resource limitations, and demanding postoperative care. The objective is to demonstrate when a local or regional flap can adequately restore function and appearance. The first 5 chapters are organized according to the site of the defect: buccal mucosa, tongue, lip, maxillary and mandibular alveolar ridges with the hard palate, and the floor of the mouth. Chapter 6 systematizes the techniques themselves: the submental flap, temporalis flap, facial artery musculomucosal flap, deltopectoral flap, palatal island flap, pectoralis major flap, nasolabial flap, buccal fat pad flap, platysma flap, and infrahyoid flap. Operative photographic documentation is also provided. The structure closely reflects clinical practice. The defect, treatment objective, and patient are assessed first, and the flap is then selected. The greatest value of the book lies in its presentation of operative decision-making. Numerous cases demonstrate the tumor, the resulting defect, flap design, flap elevation, placement, and postoperative outcome. The photographs are sufficiently clear to illustrate tissue relationships and the sequence of key steps, which is particularly useful for surgical trainees. However, a photograph of a successful case is not evidence of the superiority of a technique, and the book should therefore not be read as a comparative study. The scientific support is the book's greatest weakness. In the available document, I did not identify a separate bibliography or systematically cited references supporting most of the clinical claims. Meta-analyses concerning surgical margins are mentioned, as is the absence of randomized data in one section, but in general the book does not allow the reader to verify the sources or assess the quality of the evidence. It therefore cannot be claimed that its recommendations are systematically based on randomized studies, guidelines, or consensus documents. The reliance on the author's experience and case series is much clearer. They themselves state that their institution manages more than 500 head and neck tumors annually. As an atlas of experience, this is legitimate. As an evidence-based guideline, it is insufficient. Based on the available sources, the currency of most individual references cannot be assessed reliably. One of the most useful messages is the application of the reconstructive ladder. The authors relate flap selection to the size and depth of the defect, available tissue, functional objective, comorbidities, dentition, previous radiation therapy, and available resources. For smaller posterior buccal defects, they describe the buccal fat pad. For anterior and middle defects, the nasolabial or submental flap. While larger and through defects are more often directed toward free microvascular tissue transfer. The second important topic is the submental flap. The authors acknowledge the controversy surrounding its oncologic safety and recommend caution when metastatic disease is present at neck level 1, particularly when extranodal extension is present. An independent meta-analysis comparing the submental island flap with free tissue transfer found shorter operative time and hospitalization, lower donor site morbidity, and similar rates of flap loss and recurrence, but it included only 5 studies and a relatively small number of patients. The author's caution is therefore justified. The technique has a role in carefully selected patients. The third strong area is reconstruction of the tongue and floor of the mouth. The book emphasizes that the objective is not merely to close the wound but to preserve tongue mobility, provide adequate tissue volume, prevent tethering of the tongue to the fixed gingiva, and anticipate fibrosis after radiation therapy. For the floor of the mouth, the authors emphasize the need for thin, pliable tissue, prevention of communication between the oral cavity and the neck, and rehabilitation of speech and swallowing. This is a clinically mature approach because success is measured by function rather than by flap survival alone. Problems arise when the book moves from reconstructive surgery into oncologic recommendations. In the chapter on the tongue, it states that in early carcinoma with a clinically negative neck, whether elective neck dissection should be performed remains a matter of debate, with surveillance presented as an option, while sentinel lymph node biopsy is described as gaining importance. Independent verification shows that the American Society of Clinical Oncology guidelines strongly recommends elective neck dissection for most operable oral cavity carcinomas without clinically apparent nodal metastasis, while specialized ultrasound surveillance is an alternative only for carefully selected patients with the earliest tumors. A randomized multi-center comparison of a sentinel lymph node-based approach with elective neck dissection also exists, meaning that this topic can no longer be adequately described simply as a technique that is beginning to be used. The author's statement that a surgical margin greater than 2.5 mm is sufficient should be interpreted with particular caution. This statement is made with reference to specimen contraction and several unnamed meta-analyses. A systematic review and meta-analysis published in 2026 continues to treat 5 mm as an important threshold and reports less favorable outcomes with narrower margins. This does not mean that every patient with a smaller margin has been inadequately treated, but it does mean that the position presented in the book should not be converted into a universal rule without stronger documentation. The same applies to adjuvant radiation therapy. In the chapter on the tongue, the authors restrict its indications primarily to positive margins or nodal metastasis. This is too narrow. The American Society of Clinical Oncology guideline states that characteristics of the primary tumor, including perineural invasion, lymphovascular invasion, and a locally advanced primary tumor, may also constitute indications for postoperative radiation therapy. The book itself later provides a broader set of risk factors in the chapter on lip carcinoma, including perineural and lymphovascular invasion, demonstrating a degree of internal inconsistency. The book's greatest strengths are the concrete visual teaching of surgical steps, realistic selection of reconstruction according to the defect and available resources, open discussion of the disadvantages of individual flaps, including trismus, microstomia, venous congestion, temporal hollowing, intraoral hair growth, and donor site morbidity, the consistent return to speech, swallowing, mastication, and oral competence as functional objectives, and its particular value in settings where free microvascular reconstruction is not always available. Its weaknesses are the absence of a verifiable bibliography, the lack of formal grading of evidence, occasionally overly categorical oncologic recommendations, limited use of standardized functional outcomes, and the absence of a clear algorithm integrating defect size, dentition, previous radiation therapy, nodal status, and flap selection. For dental students, the book is useful for understanding the consequences of oncologic surgery, although its technical content is above the level of basic dental education. For general dentists, its value is primarily educational. It will be most useful to trainees in oral and maxillofacial surgery, head and neck surgery, and reconstructive surgery. For specialists, it can serve as an atlas of alternative reconstructive solutions, while educators may use it as a source of clinical cases, but it should not be used as the sole source of oncologic recommendations. 3 professional principles stand out. Reconstruction should be planned according to the defect and the functional objective rather than according to the prestige of a particular technique. Local and regional flaps continue to have a legitimate role in the era of microvascular surgery. And oncologic safety must always take precedence over the technical elegance of reconstruction. Does the book deserve a place in a professional library? Yes. Primarily for oral and maxillofacial surgeons, surgical trainees, and head and neck surgeons. A dentist who is not involved in oncologic or reconstructive treatment and is looking for a general textbook can reasonably skip it. Its greatest value is the practical and visual transmission of surgical experience. Its greatest weakness is the poor traceability of the scientific evidence supporting some of its oncologic recommendations. It is best regarded as a clinical atlas and supplementary operative literature rather than as a guideline. When read in this way, with contemporary oncologic recommendations checked in parallel, the book is worth the time required to read it.